Dr. Dean Yimlamai is here now talking about AASLD's important session on the intestinal microbiome and pediatric liver disease. And there is so much research in adults.
There is.
But truly a very little understanding in children, unfortunately.
Yeah, less than 1% of actually all the papers in the literature have anything to do with pediatrics or liver disease. I looked just last year, there were 20 papers, but clearly it's not 1% of the population that is pediatrics.
And clearly it's critical to begin treating early to affect some change, to prevent disease and to improve health.
Yeah, so we know that there are differences in the microbiome of all of us, and it changes from the moment you're born through school age, adolescence, adults. But all of the work, I would say, I shouldn't say all, but 99% of the work is being done in adults. There are critical periods of our life where changing the microbiome or giving products of the microbiome can change disease. We know that seems to be true for diabetes, asthma. It's starting to become more true for Crohn's disease, inflammatory bowel disease. We're really at the beginning for liver disease. We know that there's something different and that we can make liver disease better or worse. But what that is in pediatrics, we just don't know.
Right, and to try to limit the possibility of having to do a transplant.
Yes, I mean, I unfortunately have some patients who are, in their late, I would say early to late teens, who have significant inflammation and fibrosis, so NASH. And that is one of the biggest predicted reasons for transplantation in the next 15 to 20 years. So, I mean, if you can imagine that there'll be children today who are 12 years old who might be a 25 or a 30-year-old patient who needs a transplantation, if we can change that. And I think that's part of why we organize this symposium. Get some experts together to not only talk about what's known for adults, but try and apply that to children as well, so that we can get people excited. Begin to collect samples, apply some of the things that we're learning about adults to children so that we can change this disease.
So would you encourage physicians to try to do samples in their clinical practice?
I definitely would. I would definitely suggest that clinicians get in touch with many of the investigators that are coming. We need to make a larger group of people who are interested in pediatric liver disease, because really pediatric liver disease is going to become adult liver disease. And we'd like to avoid some of the consequences for people who are going to live 50, 60 years.
So how do you bridge that gap between, okay, we take a sample from my patient and then getting the proper research in that pediatric patient, as opposed to just maybe getting some information back about that individual?
Yeah, so there's a lot of sequencing studies now running out of the NIH, and about 10% of these budgets are dedicated to pediatrics, mostly because it's well known that there's potentially a large disease burden, and also we can make a big effect. Obviously, if we can spend $1 today and instead of spending $100 in the future, that's what we'd like to do. So the NIH has several consortia, and they actually have lists of investigators on their site that can point interested parties to.
I think intuitively physicians really have been treating their patients using some of the adult data, perhaps knowing that it will work in children. Is that something that you would encourage?
I would say that we just don't know if it's true. And I think in a couple other cases, we know that things like antibiotics or even ursodiol doesn't seem to help. So there's something different that we should be doing about children. And again, the first thing we need to do is just collect samples, get a brain trust of people who are interested, and again, that's why we organize this symposium, to get people excited about studying the disease, and also get a nucleus of people who can get samples together and ideas and say, is what's going on in pediatrics the same as in adults, or is it different? Probably it's a little bit of both.
Well, that's why this meeting here is so important, bringing everyone together to put the spotlight on this, put it under the microscope, and hopefully get some more data that would be meaningful for the patient. Thank you so much, Doctor.
Thank you.